Choosing a healthcare provider or facility is a big decision for many because they hold your lives in their hands. Tonight, we introduce you to 4 people here in Kern County. Their families say the treatment they received at local healthcare facilities led to other health issues and in some cases even death. We also speak with 2 doctors who say while the medical industry is difficult to navigate, there are ongoing conversations to increase patient safety. And if you're unsure about a doctor or a medical facility, there are resources available to you. This is Do No Harm, Loss and Liability in the Medical Field. Tracy Dominguez still feels the void of her daughter, Demi Dominguez, who was 23 years old and about to graduate from college. She was pregnant with her first child when they both died. Her mother tells me she believes her daughter's death was preventable if medical professionals would have taken her symptoms seriously.
The system failed her.
It was April 19th, 2021, when Tracy Dominguez's life changed forever. That day is when her daughter, Demi Dominguez, who was 8 months pregnant, died. Shortly after that, the family experienced another loss.
We lost her, and 18 hours later, we lost Malachi.
Through tears, Tracy tells me the pain Demi was experiencing during her 3rd trimester on April 15th, days before her death.
Demi started having symptoms. She was swollen, and she didn't feel good.
When she couldn't see her regular OBGYN at the time, Demi still went to get checked.
She advocated for herself, and we did as a family, and we decided let's go to the local hospital, and she's not feeling well. But that's what you do. You go to the hospital when you're not feeling well.
But Dominguez says help for her daughter turned into tragedy.
It just escalated into a cascade of errors.
She says when they were checking in at the hospital on April 15th, Demi was explaining her symptoms and they were ignored.
There was a man in the back with scrubs at the time. We don't even know who he was, but he asked her, what did you eat? And that's when she proceeded to say she had, ate Mexican food. And that's when he proceeded to say, well, you're swollen because you ate Mexican food.
Dominguez says the doctor's response shocked her.
He body shamed her. She kind of didn't know how to react to that, and neither did we. So then she went into the next room, and that's when, they put her on the monitor and her blood pressure was high. So they said they were going to monitor her.
But Dominguez says they didn't watch her. Instead, they gave Demi medication and stated she would stay in the hospital for 24 hours, only to be released early. California Department of Public Health documents found the physician notes from April 15th showed her medical record contained no formal diagnosis.
In the morning, I'm here, and she's walking through the door. And I'm saying, well, what are you supposed to be here? I'm supposed to pick you up at 2. Well, the nurse gave me the prescription, told me to pick it up and go home and bed rest and call my doctor in 2 days.
Demi did see her OBGYN doctor 2 days later, but according to her mother,
never examined her, asked her absolutely no questions about anything, and said, bed rest. And then he kind of just rushed her out and, oh yeah, Dad, give her a massage. Yeah, but and come back, in your next appointment.
That night, Demi had a seizure at home and was unresponsive. She was then taken to the hospital where she and her son later died.
When they come out and tell you that your daughter didn't make it or that they pronounce her dead, I literally just fell to the floor.
Dominguez says because of the shock of Demi's death, she never got to meet her grandson Malachi, who died a few hours after Demi.
I was just out of it. She had, there was a lot of people there, her friends, and everybody was screaming and crying. And I, to this day, I didn't get to go see Malachi because I was not in the right place and my mind, and I was hysterical.
Due to the California Confidentiality of Medical Information Act and HIPAA laws, there are no names on public medical records. But based on what Dominguez says, the documents that match Demi's case from the California Department of Public Health found, quote, the facility failed to follow its policy and procedure for assessments related to hypertension and preeclampsia. They also state, quote, based on interview and record interview, the facility failed to protect patient rights for one of one sampled patients when physician 1 did not perform a physical examination or speak directly to patient 1 regarding her diagnosis, treatment, prognosis, plan of care, or follow-up. This failure had the potential to result in lack of information on patient 1's healthcare status and provision of inappropriate treatment. Her mother maintains when she was there, she did not feel like her daughter had proper care.
It's true that she never was seen by a doctor, never had a proper diagnosis. Never once was the protocol followed for preeclampsia by the hospital. Never urine intake. Never checked to see if she had edema. Nothing was done. Absolutely nothing was done. And that's why she lost her life.
Dominguez says now her family is navigating their pain by taking action.
Trying to educate the nurses too, and the hospital and the doctors to take women of color serious, their symptoms seriously. I mean, she had every classic symptom, but nobody listened.
Through her advocacy and speaking at events about patient safety, she's learned she's not alone and believes it speaks to a bigger problem across Kern County.
And we do not have the best doctors. They don't really care here. That's why I feel like we have such high rates of all these medical negligence and fines, because they're not doing their job. And they just don't care.
And when it came time for Demi's sister to have a baby, they drove 2 hours to Santa Barbara for every doctor's appointment and her delivery to try and ensure she got the best possible care. While Demi's sister was able to safely deliver her baby, Dominguez says seeking care elsewhere shouldn't be necessary and wants patients to know how to support themselves.
We have rights, but we don't know our rights because we just don't know. We just trust the doctor and the hospitals and the nurses. And I just want to tell the nurses, listen to your patients too, follow the protocol, follow the rules, you will save a life.
But she says Demi's death still feels like it was just yesterday, and they're still learning how to move forward.
As far as we're still trying to figure how to do this and how to go on.
Dominguez has also spent the last 2 years helping bring to life the Latina Maternal Health Fair to help educate mothers of color about how to make their own health care choices and speak up for themselves. Demi's family has also filed a wrongful death lawsuit against the local OBGYNs according to court documents. The jury trial is expected to begin May 13th, 2024.